Good afternoon, everyone, and welcome to this week's installment of Schoeneck King's Business in 2021. As a reminder, if you could take a moment to fill out the survey at the end of the webinar. We really appreciate that feedback from you. Also, during the webinar, please feel free to put any of your questions right into the chat or the Q&A, excuse me, and we will do our best to answer them live during the webinar. If not, we'll try to get to them at a later point, either next week or sometime during the week or next week during the webinar. So thank you again for attending this week's installment. We've got a great program for you. It seems like there have been quite a few developments in many different areas over the past week. So we're going to bring some of those to your attention and provide a discussion of what they might mean for your business. So to start us off, we're going to have Kirsten Barkley. Kirsten is an attorney in our Rochester office who works in our school law group, and she is going to give us an update on what is going on in the world of school laws. Kirsten, take it away.
Thanks, Adam. Next slide, please, Matt. So as Adam said, I'm Kirsten Barkley, and if you are paying attention to school reopening stuff right now, you'll notice, there's a lot of uncertainty in New York State about what's going on. So we're going to spend a little bit of time this afternoon just walking through what we know as of today. Next slide, please. So you may know that a couple of weeks ago, the New York State Department of Health announced that it would not be providing school reopening guidance because the emergency executive orders had come to an end. The Department of Health recommended that school districts and schools use CDC's guidance. So this is the list of guidance that is available to you as you create your opening plans. In addition to CDC guidance, there is also the American Academy of Pediatrics guidance. There is continues to be a public transportation order that remains in effect from the CDC. And the New York State Department of Education on Thursday used the federal guidance to create a health and safety guide. One of the recommendations in the health and safety guide is that you consult with your county health officials as you create your opening plan. Next slide. There are at least 2 data points that we recommend you consider as you're creating your school opening plan. The first is your area's vaccination rates, and the second is your county's transmission levels. So on the left is just a snapshot of the most recent data we have for New York State's vaccination rates. And you can look at this data and see that for children between the ages of 12 and 15, we're starting to see an increase in children becoming vaccinated. The same is true for that 16 to 25 age group. Unfortunately, we don't have disaggregated data that would tell us, up through age 18, for example. So the second data piece is your county's transmission level. Last year, you'll recall we used yellow zones, orange zones, and red zones. And this year we are using the CDC framework instead. And there are 4 levels of transmission. Of the 62 counties in New York State, you'll see that almost all of them are at the substantial transmission and high transmission rates. Next slide. So using, again, at least those 2 pieces of data, you can begin to think about the strategies that you'll use in your opening plan. The ultimate goal, both of New York State guidance, but also what we're seeing nationally, is that schools are open full-time for in-person instruction. So the mitigation strategies are driven by or are in support of that ultimate goal. The first and primary strategy that we are hearing this year is vaccination promotion for children ages 12 and up. And also you can be thinking about your vaccination promotion for children younger than 12, as we expect to see that approval come sometime this fall. The second mitigation strategy is related to masks, and the CDC recommends universal masking while indoors, regardless of vaccination status. For adults and children who are unvaccinated, their CDC recommends that they are masked if they are in crowded outdoor areas. Another big area of recommendations is screening testing, which means testing unvaccinated and asymptomatic teachers, staff, and students at least one time per week. And then what we called social distancing last year is referred to as physical distancing. And the CDC recommends that for groups who are vaccinated, there is a 3 feet plus mask rule, and groups not vaccinated, a 6 foot plus mask rule. Unlike last year, where we reduced the number of children in classrooms in order to meet these distance requirements, that recommendation is no longer in place, and instead the recommendation is to layer these other strategies with this one. The cohorting is still a recommendation, although the nuance here is that that recommendation is for substantial and high transmission areas specifically. Next slide. These are some examples of strategies that we were using last year that are carried over into this upcoming school year. So improved ventilation, hand washing, the cleaning, and of course, staying home and getting tested when sick. And then I think importantly, there are strategies that have been removed. We don't see hybrid instructional models anymore in any of the new guidance. We also don't see those daily temperature screenings and those screening questionnaires that we were asking families to complete daily. Next slide. So the rule overall, again, is that if public health officials are allowing schools to be open, they should be open for in-person instruction. And if there's a closure due to public health emergencies, you need to be prepared to pivot quickly to remote instruction. I want to just note that 8 out of the 10 or 80% of the largest 100 school districts in the country are offering some remote option. So it's something for you to be considering now. And also, as you'll recall, the special education provisions under the IDEA and Section 504 for students with disabilities, as well as the ADA requirements, have remained the same prior to COVID and throughout the pandemic. And so one of the conversations that we are having is this idea that remote instruction is more likely to be considered a reasonable accommodation going forward, because there was so much evidence from last year that it is in fact possible. Next slide. So this is a big one. People are wondering about what to do with sports and extracurricular activities. This chart is a combination of both the CDC guidance as well as last year's New York State Department of Health guidance for sports and recreation activities. And so what you can, and I'm going to focus just on the substantial and high transmission areas. And what you can see is that for the high-risk sports and activities like chorus and band, the CDC recommends that screening testing, again, for the unvaccinated and asymptomatic participants, is happening twice per week. If you are in one of the 40 counties that is an area of high transmission, however, the CDC is recommending that you cancel those activities and sports or hold them virtually unless all of the participants are fully vaccinated. And then for the low and intermediate risk sports and activities, Again, for those substantial and high transmission areas, the recommendation is screening testing at least once per week. Next slide. So I just wanted to show you some of the questions that we are getting from some of our clients. The first question relates to whether you're still required to follow last summer's New York State Department of Health guidance. Last summer, it was a mandate under the emergency executive orders, but this summer, since those have ended, it is no longer a mandate, but it still is just active guidance in the same way the CDC guidance exists. You do not need to resubmit a school reopening plan, but we're recommending that you have written procedures for closures, remote instruction, layered mitigation strategies, and quarantine, and that you communicate those strategies regularly out to your school communities, parents, guardians. Face masks are still required on school buses. It's the same mask rule that we used last year. And that's because the mask requirement was actually not part of the state guidance or state mandates. It was a federal mandate from the CDC. We've been asked if fully vaccinated individuals need to quarantine if they're exposed to COVID. The recommendation is that they don't need to quarantine if they're asymptomatic, but that they should get tested 3 to 5 days after exposure and wear a face mask for 14 days. As I mentioned above, we've been asked if the CDC guidance is a legal mandate. It is not, in the sense of what we went through last summer with the Department of Health requirements and the state ed requirements. But we are recommending that if you're going to deviate from the CDC's recommendations, you consult with both your counsel as well as your insurance carriers so that you can better understand the risks associated with not following the recommended guidance, the recommendations. And finally, the question around whether schools can require students to be vaccinated. They cannot for purposes of attending regular school, but you can, however, require vaccinations for students who are eligible in order for them to participate in sports and extracurricular activities. So I'm sure you have some more nuanced questions. As Adam said, we'll try to take some questions at the end, but if you have additional questions, we'll try to get back to you as soon as possible.
Kirsten, thank you so much. This was extremely helpful. I know I've spoken with a number of school district clients who are confused about number one, and rightfully so, because if you go to the state's website, which I did this morning, the school guidance is still under the quote unquote active category. So it's not clear whether or not that guidance is still active, but you answered the question very clearly. So I appreciate that. Great information. Thank you again. Katie just put a note into the chat, and I apologize, I messed up. I mentioned the chat at the beginning of the webinar. Please, if you have questions, put them in the Q&A section, and we'll try to get to them there. That was my mistake, so I apologize. All right, next up, we are going to move to Hermes Fernandez. For those of you who've been attending these webinars for the past year, you have seen Hermes on these a number of times. Hermes is an expert in all things COVID and has given us wonderful updates over the past year. He's going to provide us with another update today. So Hermes, please take it away.
Thank you, Adam. As Adam mentioned, I have spoken on a number of these webinars. I haven't spoken in quite some time. And unfortunately, that means things are not where we want them to be, which is why I'm speaking, because one of the things that I've done throughout the course of this pandemic, is I've followed closely the developments regarding the virus itself and vaccines. And so that's what I was asked to talk about today, really about what has transpired recently in regard to the virus and vaccines. So let me start with those of you who may have sown some wild oats back in your college days or maybe even high school days. Remember after a day or a night of hard drinking, and people would be feeling awful and saying, please God, let me get through this. I'll never drink again. Last year, right, we were as a nation saying, please God, please Donald Trump, please drug companies, find us a vaccine. Let us get past this terrible epidemic. Well, we've got a vaccine. And just like some people never drank again, some people have gotten vaccinated and some people haven't. And that is, to a large extent, why we are where we are today. You may remember last year and even earlier this year when Katie Anderson and I would speak, and we would talk about the virus's course. And the virus, we said, or we repeated what we were learning from scientists and from physicians, was that the virus would continue to circulate, right, until it ran its course. And a pandemic can run up to 4 years, and that is actually remains the prediction for this pandemic, is that it will run 4 years, and we're in year 2 of a virus that circulates from human being to human being, and actually even in some animals. And the virus looks for hosts. And the point of becoming vaccinated, or maybe even becoming ill, is that you will not be able to host the virus. Well, over time, the virus has mutated, and we are now at the Delta virus. And the Delta virus is, right, it is a COVID-19 virus. It is simply a variant of the original virus, but it has certain, it is mutated in certain ways that are causing us serious problems. Most significantly, the Delta virus is 2.5 times more contagious than the original COVID virus. And the original COVID virus, you will remember, felled New York City and Long Island and New Jersey, right? We had 30,000 deaths at the time in New York alone due to the original virus. The original virus was expected, if you became contaminated with the original virus, you were expected to contaminate 2 other people. So that was the measure of its contagiousness, right? One person would infect 2 others. The Delta variant, well, if you become contaminated with infected, I guess it's a better word, infected with the Delta variant, you were expected to infect 5 other people. That is hugely significant, and that number makes the Delta variant of the COVID-19 virus similar in its ability to infect others and in its degree of contagion to the measles. And measles is considered a highly infectious disease. In terms of its spread, it's also very interesting and dangerous in that we often spoke about close contact. And Kirsten's presentation was so illuminating regarding spacing in schools, right? Well, the spacing and masking is because of the question of what is a close contact and the ability of this virus to spread. So with the original variant, it was a close contact, which this is the amount of time you needed to be next to someone in order to become ill, was thought to be 10 to 15 minutes. With the Delta variant, that number's down to 5 minutes. So we have a disease that spreads, that has mutated to spread much more easily. And that's all right, that's all to the bad. What's to the good is that we do have vaccines. And I think I have some more updated numbers from the numbers that Kirsten showed with you. In fact, for the last year and a half, and I'm sure many of you have received Andrew Cuomo's nightly COVID-19 report, which sadly, the last of those reports was issued last night. It began with the governor saying he's not going to be issuing these reports any longer. But New York, in the report that the state distributed last night, 70.2% of New Yorkers are fully vaccinated. So that's a significant number. That was the number that was thought to bring us to herd immunity. because of the extreme contagiousness of the Delta variant, I've seen some physicians now discussing 90% as being what it will take to get to herd immunity. While we still have these gaps, right, we are dealing with, well, what does the Delta variant mean? And it means a return to many, but not all of the measures we saw previously. Kirsten was talking about in masking in schools, right? The reason now we are being talked to and said, please mask again, is because the Delta variant is so contagious. And we are seeing breakthrough illnesses among those who are vaccinated. Now, the breakthrough illnesses doesn't mean someone's going to die. And, a vaccine isn't an iron shield. A vaccine gives people protection to a certain level. Remarkably, the Pfizer and the Moderna vaccines have been, they're in the Hall of Fame of vaccines at this point. They are extremely, extremely effective. And they remain effective, although less effective against the Delta variant. The Delta variant, simply because of the contagion loads, the virus loads that come to people, it's causing people who may be asymptomatic, as we had with the original virus, but now with people who are vaccinated, they may themselves be asymptomatic, but they can easily spread the disease. So we're seeing more public concern, and we're seeing now government, right, at the state and federal level, encouraging employers to require vaccinations, right? We are moving across the Rubicon of vaccinations from vaccine availability to vaccine requirements. The law is not mandating vaccines, right? This New York State legislature has not mandated vaccines, but the New York State Department of Health, although I still haven't seen the actual order, yesterday announced, or actually announced under the governor's letterhead, that the Department of Health is requiring vaccines for healthcare workers, essentially healthcare workers under its jurisdiction in physical settings. So the Department of Health has announced a vaccine mandate for hospital workers, nursing home workers in adult care facilities. There's some question how far the order goes, whether it reaches other things like home care, because we haven't seen the order yet. But that's very significant. We're seeing employers, and I know you've talked about this in earlier webinars, now requiring vaccinations. Right? New York City is now requiring proof of vaccinations, and this is the first day this is effective, before you can go to an indoor restaurant, before you can go to a gym, before you can go to a bar. So some of these things that we talked about in the past, right, are now coming to fruition because of the continued transmission of the Delta variant. We don't know where this all ends. I will tell you that looking at recent numbers nationally, 50% of the country is fully vaccinated. That varies widely among geographic regions of the state, the United States. If I were to look down south, the numbers are literally in the 30% range in the states bordering the Gulf of Mexico, except for Florida, which is at 50%. So Florida matches the national averages. Some of these other factors that are very interesting is what we're really looking at is holdouts and children. Of those over 18 nationally, 62% have one shot, 72% are fully vaccinated. Age may bring wisdom, or age may bring fear, but among those 65 and up, 91% are fully vaccinated nationally. Have one shot, and 81% are fully vaccinated. So 91% with one shot and 81% fully vaccinated. And that's largely why we don't see the death numbers matching what we saw. We're now in the nation's fourth wave, right? Starting with New York, New Jersey, California, more than 18 months ago, to our fourth wave today. I'll bring up one other thing, which is the status of vaccines. Just overnight, right, we've learned that the Biden administration is recommending that the fully vaccinated get a third shot in their 8th month after their first dosage. That is intended to boost further the immunity, because it's still not clear how long the immunity lasts from the other shot, from being fully vaccinated. There's also continued issues regarding the fact that in the United States, we don't yet have any vaccine that has been fully approved. Every vaccine that's approved at this point has been approved through the emergency use authorization process, which is causing at least some people to be vaccine hesitant. So very quickly, vaccines go through an approval process. It's usually fairly lengthy. It has clearly been shortened for these vaccines, but it has been shortened really with extremely strong guardrails, because this entire process has been under work for 10 years to develop a faster process. So in phase 1, vaccines are tested for safety and dosage. In fact, in phase 2, they're tested for safety. Phase 3, vaccines are tested for safety and efficacy, right? The all-important efficacy. Emergency use authorization or full approval come at the end of that. Full approval is really more of you're looking at length of time, simply to continue to watch to see how things develop in the population. There are currently worldwide 99 vaccines under development. Right, we know we talked about in the United States, Moderna, we've talked about Pfizer and Johnson and the Johnson & Johnson vaccine, but there are many others. There are others that are in use in China, in Russia, and Brazil, in India, in other countries, in Switzerland. In fact, the Pfizer vaccine fully approved in Switzerland and Brazil and some other countries. Why are there so many vaccines under development? Because the belief is that there's a lot of money to be made out of vaccines, because it's expected that as COVID-19 continues to mutate, what we'll be moving from is from a pandemic, which is where we are now, to an endemic disease. In other words, we are moving to having COVID-19 with us, as we have other coronaviruses like the common cold. It will remain there. It will remain a threat like the annual flu. We see flu vaccines every year. This is going to be something that's with us, and it's going to need to be managed for the. I can't say the foreseeable future. It may be beyond the foreseeable future, but that's where we are today. So thank you, Adam. I can turn this over.
Hermes, thank you so much. That is incredibly helpful and useful information. We do like having you on, even when things aren't going so badly. So, please feel free to come on anytime you want. Next, we will turn to Katie Anderson.
Death these days.
Exactly. Next, we'll turn to Katie Anderson, and Katie's going to give her up from Albany. Katie has a lot to talk about this week, as she does every week. So, Katie, please take it away.
Sure thing. Yes, there will be a little bit of overlap between what I'm going to talk about and what Hermes has talked about, but I've been looking at your questions in the Q&A. I'll be trying to answer them as best as I can as we go on. So let's look at where New York is today. Hermes, when he was discussing this, he said we're in the 4th wave of COVID. New York is really in its 3rd wave, because remember last summer, New York was not to a great extent impacted the same way that other states were. But here we are, the cases continue to rise. They are rising in New York at a slower rate, but it's still not great. The rate change is no longer above 100% in the past 14 days, but we're still at an 89% change. The number of tests has gone up, the number of hospitalizations continues to increase. And looking at deaths, we continue to see a rise in those. But as Hermes mentioned, the fact that we have such a high population of vulnerable people who are fully vaccinated does help us on those numbers. Turning to what's happening region by region. Again, the Northeast remains at the bottom here. These are cases per capita. The Northeast is around 19 cases per capita at this point. remember last summer, we had the travel ban in place, right? And New Yorkers, if you went to any state that had a per capita caseload of COVID of over 10 per 100,000 people, you had to quarantine upon returning. Now, we all know the travel advisories, the travel, quarantine requirements, those are all gone. But looking at where we are now, no state is below that 10 cases per capita limit. And then you look at Florida. Florida is at 138 cases per capita. So 138 cases per 100,000 cases. That is a significant spread. We've been looking at Florida the past, few webinars. I've been using this graph. And as you can see, Florida is just a straight line in the number of cases. We are, it is looking as though the Delta variant goes up quick and then it potentially comes down quickly too. So that is what we can hope for here. But just looking at where things are, it's still not great in terms of what's happening. And this map is also from the New York Times. It's about where ICU beds are nearly full. The South is in dire trouble and is heading towards the wrong path in terms of where ICU availability. But New York, we also have some pockets, areas there where the ICU beds are starting to fill up, notably in the Adirondack region and in the southern tier. We have two areas where the ICU bed count is getting full. This was not helped by the bus crash that happened on the Thruway this weekend. Some of those people are in the ICU beds, but thankfully that crash occurred in a place where the ICU beds are largely available. So looking in terms of what's next in vaccine progress. Again, Hermes mentioned this. We finally hit the 70% of adults in New York State being fully vaccinated. Remember, this is the number that we were, aiming for in June when the state of emergency was ended. This is the number that we had said, when we reach 70% of people fully vaccinated in New York State, then we'll lift all these restrictions. Here we are 2 months later, finally hitting it. And, looking at where our progress with all New Yorkers, we continue to go up 1 percentage point at a time, basically, which is good because there were quite a few weeks where we were not moving at all. But, that 70% is good news. And we are, hoping that it will continue to increase. In terms of booster shots. So I know a lot of you are in the chat asking about Johnson & Johnson. So let me just mention Johnson & Johnson first. Johnson & Johnson right now is not authorized to have a booster, but they are doing tests right now to see how a second dose of Johnson & Johnson works and seeing how that boosts people's protections. So I expect that we're going to hear more about Johnson & Johnson in the coming weeks. I know a lot of people are also wondering about if I've had Johnson & Johnson, can I get Pfizer or Moderna? Or if I've had Pfizer, can I go get Moderna or vice versa? That all remains to be seen. Those are all open questions that the FDA is dealing with right now. Generally speaking, they don't like to mix vaccines, even though Pfizer and Moderna are made up of the same, it's MMRA. They have different formulas for how they attack the virus. So each one has a different blueprint that it gives to your body as to how it's attacking the virus. And you want to make sure that those blueprints don't cancel each other out or don't cause a reaction that is adverse to your body. So that's why there has to be these tests that are occurring, but these things are happening. It's just, Johnson & Johnson had much fewer shots that were distributed in the US, but those Johnson & Johnson shots now are really being used in a lot of rural areas and at a lot of community events. You're seeing, that the state fair, for example, they are vaccinating people there. A lot of those vaccines are likely Johnson & Johnson because of its ability to be held in places without being at such a strict temperature. Anyways, turning to what's happening with Pfizer and Moderna, the FDA last week authorized the third dose of Pfizer and Moderna for immunocompromised individuals. This is less than 3% of the population. These are people who are actively receiving chemotherapy, people who are have HIV that is at a certain threshold. So we're talking about extremely immunocompromised people, but it is likely that the booster shot for Pfizer and Moderna is coming down the line. We are likely to hear more about it this week. Just looking at the numbers that Israel has been putting out, demonstrating the efficacy of the Pfizer vaccine after 8 months does show some waning. So that is why we're looking at this 8-month out booster to occur. So keep your eyes out for that. That will likely, there's a good chance that that's coming this week. And so now let's turn more to New York. Last week, remember we were talking about we gave this webinar right as the governor was resigning. During that we said, there's a good chance we're not going to see anything major with COVID happen in the next week or next 2 weeks during this transition period. We were wrong, and I'll be the first to admit it. Yesterday, the governor issued a press release saying that all healthcare workers in New York State, which includes staff at hospitals and long-term care facilities, and also congregate care facilities, have to receive 1 dose of the COVID-19 vaccine by September 27th. That is new. We still haven't seen the order. The order hasn't been published. I just checked right before I started speaking again. It's still not out. But it is a significant amount of people that will need to comply with this. It's 75% of hospital workers are already vaccinated, but you still have 25% that aren't. And that number continues on and on with adult care facilities and with nursing home workers. So we will continue to monitor that and continue to advise once we can finally get our hands on that order. In New York City, as of today, you will need to present proof of vaccination to enter any indoor dining, fitness, or entertainment facilities. New York City will not be enforcing this, though, until mid-September. It is just to give people a month to get used to this. But businesses in New York City will need to be the ones enforcing this. So you will need to be, if you are in New York City, you will need to be checking at the door if you fit into any of these, areas, any of these buckets. So what else is happening in Albany? Just, I learned my lesson. We always keep this slide brief just in case something happens right before the webinar starts. But luckily today, not a ton has happened this morning. So the governor's resignation, we still haven't seen the official resignation letter, but his resignation is deemed to occur on August 23rd at 11:59 p.m. So that's when the governor will be resigning next week. At this time, we will have a new governor, Kathy Hochul. Looking at, what's the turnover that we're going to see? We've already seen certain Cuomo loyalists saying that they will be resigning with the governor. So Linda Lacewell, the director of the Department of Financial Services, that she will be gone. And we'll continue to watch that closely. Again, the lieutenant governor has said that she will not be having anybody in her administration that was named in the Attorney General's investigation report as doing bad deeds. So there's a fair number of people that may be out of the governor's office in the next week. Looking at the Assembly investigation, so last Friday afternoon, the Assembly Judiciary Committee chair and the Speaker of the Assembly announced that the Assembly would no longer be moving forward with the impeachment proceedings and would not be releasing the findings that they have put together thus far. This was met with an enormous outpouring of rage by both Republicans and progressive Democrats and good government groups. saying that those findings, New York State has spent $10 million thus far on putting these reports together, and that New Yorkers are entitled to see that. So yesterday, the Speaker and the Chair of the Judiciary Committee in the Assembly announced, okay, we are going to be releasing the findings, and we will continue on with the investigation. But they have concerns that you can't impeach an individual once they have left office. The New York State Constitution is different from the federal Constitution. So obviously under the federal Constitution, we already have a precedent for impeaching an official once they've left office. But in New York, that precedent doesn't exist. So with that, Adam, I will turn it back to you.
Katie, thank you. That was great. I just have a couple of notes before I move into the FAQs. First of all, a couple of questions we received in the chat related to what is a congregate care setting as identified in the governor's press release. And the answer is we don't know yet. Hermes, did you have something you wanted to add there?
Well, we know in part what it is, right?
Right.
We know that they are nursing homes. We know that they are adult care facilities, which would include assisted living facilities. But we don't know if it's going to include OPWDD facilities, community residences. We're waiting to see if OPW is actually able to issue that sort of regulation themselves. The Department of Health has special emergency powers that not all the other agencies share.
Thank you, Hermes. See, you should be on these all the time, Hermes. You got to pick out the answers. The other point I would make is that just before we started our webinar today, Onondaga County announced that all school employees, vendors, and contractors would have to be vaccinated or tested weekly. So to follow up on Kirsten's discussion a little earlier, you might see local governments taking matters into their own hands, and Onondaga County, it appears, has done that. Okay, so we only have a couple of minutes left. I wanted to hit on a question that I've been getting quite a bit recently, and that is we have employees who are not vaccinated. If they contract coronavirus and are then subject to a quarantine order, do we have to pay them COVID leave? And that's a good question, because you, as a business, you're saying, wait a second, they have the ability to get vaccinated theoretically, unless there's some medical or religious reason why they cannot. But let's assume that they could get vaccinated. They've made the decision not to. Then they get COVID. Then they're under a quarantine order. Why do I have to pay them? Or do I have to pay them? So unfortunately, the answer is you still do have to pay them. New York, if we go through the sources of potential COVID paid leave, you start with New York's COVID paid leave law, which provides paid leave for individuals who are subject to a quarantine order. And the amount of that paid leave depends on the size of the employer, but that law is still in effect. There is no exception or exclusion in the law for those who have had the opportunity to get vaccinated and who have refused. So even though it might be frustrating to you, those individuals still should be paid pursuant to New York's COVID paid leave law. The other sources of paid leave, if just by way of review, there was the federal Families First Coronavirus Response Act, expired at the end of December last year. That was extended through the American Rescue Plan Act, however, extended only voluntarily. So if you as a business did not decide to voluntarily continue to offer the FFCRA benefits, you didn't have to. There's also paid leave for individuals who are getting vaccinated. So there's New York's COVID paid leave law that applies specifically to time spent getting vaccinated. I would also point out the regulation from the Department of Labor in January of 2021, which aimed to expand the situations under which New York COVID leave law requires employers to pay for COVID leave, and it expands to those category of employees who are being told to stay home by an employer, even though there is no quarantine order, if they're being told to stay home due to exposure to somebody with COVID. So the answer to the question is unfortunately yes, even if your employee makes the conscious decision not to get vaccinated, if they contract the virus and are subject to a quarantine order, you're still going to have to pay them. So with that, we will stop for today. Thank you again to everyone. Thank you for submitting your questions. We do look at those questions and try to craft our webinar based upon what you say. So thanks so much. Really appreciate it and look forward to seeing you next week.